All right, now we're going to start covering examples of diseases that illustrate some of the important features of um, control of infections. Right now, we're going to go over viral diseases that cause skin rashes. This is covered in the textbook under smallpox. I think it's page 989 to 995. There's also a section in chapter 22 on viral respiratory diseases causing skin rashes. That's chickenpox and measles, and so important that way. And then there's a nice Wikipedia entry for smallpox, and so that'll be the main thing that we cover is smallpox. And this child here is shown with smallpox. That's those raised blisters that you see on the child, and they're filled with virus, a fluid that contains lots of virus in it. Um, so the first disease we're going to cover is smallpox, variola. It's a viral disease that has a couple of variants. Some show very, very high mortality, 20%. And this is a historical disease that was eradicated by vaccination. An effective vaccine was discovered and eventually used worldwide to snuff out these epidemics. There is a similar but very rare disease called monkeypox that can be prevented by smallpox vaccination. And so here again, you see people with the characteristic sign, um, which is this raised blister like region uh, referred to as a pox. Okay, so variola major, variola minor are pox viruses. They're very large, complex viruses, have a genome of double stranded DNA and an envelope, shown here. They're the most complex of human viruses, among the largest. They contain over 100 proteins and viral enzymes, including a viral RNA polymerase. They're unique in that they replicate in the cytoplasm of host cells. Okay, uh, we're going to go over what you would see if a patient came in with smallpox. This develops very quickly. There's a short incubation period. It's variable, but usually 1 week or less, sometimes as long as 2 weeks. People have a headache, chills, back pain, and then high fever. The virus is replicating in their organs, in their skin, and these blisters, their technical names are papules or maculopapules. They form on the face and hands. Later, they're going to be on the trunk and legs. They'll start. They're going to become raised. They are pus filled, and they will break open. The pus will come out, and then scabbing will begin, and that usually results in it scarring. Um, Mortality varies widely. In some outbreaks, it's less than 20%. Other outbreaks, it's 95%. Um, Native Americans, Pacific Islanders were particularly susceptible to this, and so high mortality also depended on kind of your genetics. People do recover from this, and so some people untreated will recover. Uh, Occasionally, they will develop secondary infections of the skin, so that means a bacterial infection will come in this wound. Um, so those are common. The skin scarring can be very, very severe. But the good news is that if you've recovered from smallpox, you will never get it again. Um, we have some treatments for people that are infected that may reduce symptoms and may improve survival, but generally, there's nothing we can get that will give you that will protect you once the infection will begin. Okay, and so this is transmitted by direct contact from skin to skin, droplets. Also, it can be transmitted by fomites, by clothing, by bedclothes, and it can be through the respiratory tract, through airborne infections. So you can have very big epidemics that occur with smallpox, and it tends to spread very rapidly, and the infections, people notice them and they are frightening, and people flee from the area, and then they will take smallpox with them. Generally, in Europe, for you know 1,500, 2,000 years, these epidemics would occur about every 20 years. When there were, after an epidemic went by, virtually everyone would be infected, large numbers of people would die, but everyone would then wind up resistant. And then in 25 or 30 years, uh, after another generation was born, they would not have resistance, and you'd have a new epidemic. Okay, the it was found that infection with a virus that people could catch from cows, called cowpox, could protect people from smallpox. And Edward Jenner is an English doctor, is credited with this discovery when he overheard milkmaids talking that they were worried about an epidemic that was going on in a nearby town. And one um, milkmaid said to another, "Don't worry, milkmaids don't get smallpox because we've had cowpox." And this Jenner tested this, and it was found that they were correct, that there were was a very, very effective way to protect people. It had few side effects, and this is because the smallpox virus, doesn't mutate much. It doesn't do any kind of exchange. And so this discovery happened in the 1800s, but we still had outbreaks of smallpox into the 1960s. Um, so it went on for a long time. And smallpox has been used as a biological weapon. That guy down there, that's Jeffrey Amherst. Amherst College is named for him, but he decided, we can clear out the Indians by giving them blankets that smallpox victims were wrapped in. And so it's a biological warfare agent. So there's a long history of smallpox. This is the mummy of Ramses. We know smallpox occurred in Egypt 1,000 years before the birth of Christ. We know there were outbreaks in Rome, that smallpox killed Aztecs, Incas, and Native Americans by the millions. There were historical outbreaks in the colonies in Boston that were very, very disruptive. So there's the Edward Jenner information, 1798. In 1967, it was proposed that we had this effective vaccine. Let's try and wipe out smallpox. There were still, in 1967, 10 to 15 million cases per year and 2 million deaths in 33 countries. And so the World Health Organization organized teams to go out and try and snuff out these outbreaks with the vaccine. And there's some really important features that made this possible. Smallpox is easily identified, not only when people have it, but also when they have had it. So you can find out where the infection was by seeing the papules and by identifying the scars on victims. It's an epidemic. It's never endemic. There are no carriers. There's no animal reservoirs, and people only have it for a short time. So if you vaccinate around these outbreaks, you were able to snuff them out. And because it was so deadly, people were very, very willing to take the vaccine. It would kill you quickly. There was nothing subtle or mysterious about it. And so that picture up top there is some of the guys that were involved in wiping out smallpox. And I think they've all died now. Bill Foege is one of them. But it was really one of the greatest achievements of mankind, was to wipe out smallpox. Nobody's gotten this for about 40 years. That's amazing. And I always put the picture of Michelangelo's Pieta there because I think that's one of the greatest pieces of sculpture ever. And everyone's seen that, or the Mona Lisa or something like that. But everyone should know about this because it's one of the greatest achievements of humankind, to wipe out such a terrible disease. And so really important. Okay, so it shows the importance of vaccines, how effective vaccines are, that if you have a very, very good vaccine, you can actually eradicate a really terrible disease. And it's an untreatable disease. So that's really, really something. Okay, likewise, chickenpox. Chickenpox is another viral infection that can be spread through the respiratory tract or through direct contact. It's a large herpes virus. That's double-stranded DNA. And the clinical features here is, again, it produces very small pus-filled vesicles in the skin. It's a respiratory infection, again, produces fever, and so people don't feel so well. These chicken pox appear on the face, on the arms, on the chest, and difficult to treat. We can't really do too much with it. Maybe shorten the infection with acyclovir, a couple other antiviral drugs, immunoglobulins, but once you have it, you have it. And this infection goes latent. It hides in nerve cells. And so it can erupt later if your immune system becomes weakened. So this is transmitted by a respiratory route. We can prevent this with a vaccine. I've had chickenpox, but many of you haven't because you've been vaccinated. There wasn't a vaccine when I was younger. Because the virus remains latent in me, I may be at risk for shingles, where the virus can be reactivated if my immune system becomes weakened. And that virus will then move down the nerve and it will erupt through my skin. And I will have those blisters again in my skin if I become immunosuppressed when I'm older, or for people that have certain genetic predispositions, it may happen to them more regularly, like if you're Native American or Pacific Islander. You can get acyclovir to lessen the symptoms, but you're better off getting a shingles vaccine. Okay, and so I just got mine this year because I just passed 60. Another example of a respiratory infection caused by a virus that produces skin symptoms is measles. This is an RNA virus that's enveloped, and it's, again, probably the respiratory route is more important, and it spreads very, very easily and through the air. This is true vehicle transmission. It produces these kind of raised I don't say blisters, but rash on the skin and in the throat. It's extremely infectious. It can lead to secondary infections of the respiratory tract. It can lead to encephalitis. Most children will recover from this, but if adults get measles, it's fairly serious, and so more of a problem. Again, this is extremely infectious, but now again we have a good vaccine, and so I've had measles, but many of you haven't because you've got the MMR vaccine, which protects you against that. And we've dramatically seen decreases in the cases of measles that happened since we've got that vaccine. You can see exactly where the vaccine is licensed in this graph. These are measles cases reported in the U.S. And so really important. The bad news is now, because we've got some vaccine resistance, is that we are now having measles outbreaks again. And so that's serious. Okay. So here, 8-year-old boy with a rash consisting of lesions, 5 days duration, spread in his school, illness matching for this. Well, one of the things I'd want to know is this kid been vaccinated for measles? If not, I would strongly suspect measles. Okay. All right. There'll be more after spring break.